Good evening, everyone, and thanks for joining us here on 13 Plus. I'm Ashley Bowerman. I hope you're all having a lovely Friday. We're going to get straight into our investigation this evening. So, getting good health care, including mental health care, can range from difficult to sometimes even downright frustrating and seemingly impossible at times. But many times it comes down to knowing what questions to ask. Our national investigative team talked to a woman who is sharing the story of her own near tragedy to make sure people do not experience similar or even worse outcomes.
A mom who almost lost her teen son to suicide is now helping families across the country navigate the confusing world of insurance and benefits. We take you inside her relentless fight for coverage.
We open many doors in our lives, but one snowy Maine day, Carmen Bombeck opened the door to her 14-year-old son's bedroom. To a moment no mother, no person can ever be prepared for on the other side of a door.
I came home from work and I came upstairs to see if my son wanted to play a game, and I found that he had hung himself.
Carmen immediately called 911 and worked to save her son's life.
It was, 30 hours until he regained consciousness. It was the longest day of my life.
The day slowly turned into years of fighting, not only for her son's mental health care, but its cost and coverage.
I think consumers in the United States are aware that insurance companies, it might be challenging. We might be skeptical about how things will go. It's worse than I could have ever imagined.
Her son, who we are not identifying, recovered. For a year, she followed all the insurance guidelines, took her son to inpatient and outpatient services. She was forced to learn how insurance works.
Were you battling a mental health crisis and an insurance crisis?
Yes.
A year later, her son's condition deteriorated again, and he ended up in the emergency room.
Staying the course with the in-network cycle of emergency room, stepping down as quickly as you can, outpatient for as long as you can stand it, back to the emergency room and stepping down wasn't going to keep him alive.
She was trying to get coverage for different treatments, and the denials were piling up. She estimates she spent 1,000 hours filing claims and appeals of appeals, 3,000 pages of documents in the first few years.
It didn't seem to matter how good my appeal was, how compelling it was, how accurate it was, how clinically necessary the care was, how effective it was. I was going to be denied anyway.
In fact, a new government report shows therapists and other behavioral health providers cut hours, reduced staff, and closed programs, turning away patients during the pandemic as more Americans needed care. According to data from the Centers for Disease Control, during the first 7 months of the pandemic, there were 26% more emergency room visits for suicide attempts compared to the same period in 2019. The report notes long-standing questions about whether coverage or claims for behavioral health services are denied or delayed at a higher rate than those for other health services. It's why Carmen teamed up with Wellbeing Trust, a national foundation focusing on changing the way the nation is addressing mental health. Together, they've created this 83-page guide to give families the tools they need to access their own benefits.
Does it say something about our system when you need a guide to help you navigate?
It says a lot about our healthcare system. We know that most individuals seeking for mental health are probably around 6 times more likely to pay out of pocket for those mental health services than they are medical services.
Ben Miller is a clinical psychologist, now working as the Chief Strategy Officer for Wellbeing Trust.
Carmen's story is extremely compelling because I think she speaks to the struggle that so many families face daily.
The guide weaves Carmen's struggle and advice all throughout it. Her real experiences finding help for her son.
I had to help other people because it's just unfathomable to me that the treatment we were subjected to by our insurer is legal.
Carmen was persistent and eventually got a denial for a residential treatment for her son overturned, so he's now covered for that treatment. She even went out of network, paying to send her son to a wilderness therapy program, a place he thrived. Today, he's 18 and just wrapping up his freshman year of college.
And it's just been so awesome to see him blossom into his own person and to see him be safe and productive. I feel thankful every single day.
This guide is out now. It's called Healthcare Coverage for the Relentless, and you can get a copy at wellbeingtrust.org. It covers all of the terminology used by insurance companies and how to exhaust your appeals process. If you or someone you know is in crisis, call the National Suicide Prevention Lifeline at 1-800-273-TALK. You can also text HELLO to 741-741. It is free, available 24/7, and confidential. For investors.
Well, it's so nice to see some families out there able to get some help in some way, shape, or form. Well, that's going to do it for our investigation this evening. I want to leave you here with a beautiful sunset on this Friday evening. I hope you all have a lovely weekend and a lovely Mother's Day. Thanks for joining us. We will see you again for more news, weather, and sports tonight at 9 and 10. We'll see you then.